Hi, everyone. Thank you so much for joining the VI Peel Body live event for tonight. I had some technical difficulties, but we are good now. So I'm going to call up the doctors and get them on the call. But I want to say thank you so much for joining us. Here we go. What is going on with Instagram tonight? Jeez. It keeps flipping my camera. Okay. Hi, everyone. I'm waiting for the docs to join. Hello, Dr. Hartman. How are you?
Hey there. How are you?
Good. I'm sorry to keep everybody waiting. For whatever reason, IG was acting really funky this evening. And so I had to log completely out and log back in. And then the camera kept flipping and turning on its own. So I'm just waiting for Dr. Fripp to join us.
Sure. Yeah, they're going to do what they want to do, right?
It's always that way. Let me try her again, even though the invite went out to her. Hold on.
Okay.
Everyone. Let's try her once more. It just said Dr. Fripp is unable to join, and I know she's sitting at ready to join. That's odd.
There she is. Oh my gosh. Hey, glam queen. I wasn't ready for all this. It's good to see you.
It's always good to see you. It's always good to see you. I love you so much.
Oh, you know, it's totally mutual. You are my sister.
I know. We've just been through so much, and look at us shining.
I know. I love it.
Listen, and the time is 6:08 if you're on the East Coast. So I just want to say to everyone, thank you for your patience on the West Coast, and good afternoon to you. And many thanks to our folks on the East Coast. Good evening to you. My name is Wendy Pittman, and I am the founding director for the Brown Skin Agenda, where we promote the advancement of treatment protocols and skincare solutions for skin of color. We all know that there's a void in the ability for providers to treat skin of color, and guess what? The Brown Skin Agenda answered that call, and this platform was created just for you so that you could speak to the experts in the field of aesthetics, most especially skin. So with us this evening, I have Dr. Corey Hartman. He is board certified dermatologist and in Birmingham, Alabama, and he's a favorite on our IG Live. And we have with us Vikesha Fripp. She is a board certified plastic surgeon, and we're so happy to have both of them here with us this afternoon if you're on the West Coast. And we're going to get into the VI Peel Body, right? The first,
let's do it. Let's talk about it.
Yeah, the first of its kind, non-invasive, pain-free peel, right? So let's get into, as a person of color, how can the VI Peel body treatments tackle unique skin concerns for skin of color? How do we get there? What do you all think? And is this much needed?
Vikesha, you go first. Ladies
so it's
first.
Definitely needed. I think there's always been a void because I'm very cautious when I treat our skin. I always gently move toward whatever my treatment plan is, because the worst thing is for you to have that hyperpigmentation. And so that's something that you avoid, and you do everything to make sure that you're giving a patient something that makes them better, not worse. So when the VI Peel Body came out, I was like, okay, it has some indications. Okay, let me see if it really works. So, I used the guinea pig of my PA. So she has to experience everything first, then I'll try it, right?
Guinea pig. So not guinea pig.
We have to. So she was up for the challenge, though. She had her elbows done, and she has beautiful skin, but she had her elbows done. And, sometimes they get darker just because it's a flexion area. So she did the VI Peel on her elbows, and she peeled like, I was amazed at how much she peeled. And then when she finished the peel, I mean, the skin was as if one in continuity with the forearm. It just went from arm to fore. I mean, it was amazing. There was no hyperpigmentation left. And though hers was minimal, right? So she didn't come in with some really, really dark spots, but I was surprised. So then I said, okay, me, right? Because I'm always ready when it works. And so I don't have much, as you can tell. I know there's not a lot to do. However, I found a little spot.
We found
a spot.
Ain't nothing changed. 20 years, ain't nothing changed. You're
like, I was 100% ready because it does work. And it clearly was a need, but it does work. And for me, it's easy to promote something that I know works.
Wow. So listen, there's always been this long-standing myth with skin of color that chemical peels are not for us.
Mm-hmm.
Can we peel away at that myth?
That is
yeah.
Right?
Total garbage. I don't know where that comes from. You know, honestly, a lot of things in our community probably get started that way because of bad experiences that people have had and then shared those bad experiences. Right. And yeah, a chemical peel, just like a lot of the things that we do in dermatology and plastic surgery, actually controlled injuries. So we are on purpose doing a little bad so that we can get a lot of good. But if that person who's doing it doesn't know how to be nuanced about the treatment, then like Dr. Fritz said, you can end up with a worse problem than you started with. So you can have more hyperpigmentation, more scarring. It's a fine line between knowing the products to use on the right skin types and then having the touch to do it in a way that will get you the result that you're looking for.
Absolutely.
We have a big practice down here in Alabama. We do more chemical peels than anybody in the state. I know that for a fact. And we also do more on skin of color than anybody else. And we have virtually no complications because we all understand that and we respect the fact that melanated skin is different. Melanated skin has different needs. So when you're increasing that cell turnover and reducing breakouts and helping to regenerate skin, you want to do it in a way that's going to protect the skin above all to deliver results that we want and not put the patient in a position where they're going to have a worse off look than they started with. So it's really, I mean, that is a total myth. Whenever I encounter that, I just tell people that it couldn't be further from the truth and they just haven't found the right person to do their chemical peels.
That's right. That's right.
Absolutely. One other thing, I'm going to go off script and ask this question because it's come up in the thread several times. You often hear people every now and again say, I didn't peel. And they may be speaking to the VI peel that we use for face, but now some are saying, hey, I didn't get any peeling with the body. What do you say to that? Because most people peel. Is it working or is it not working?
It's still working even if you didn't get a peel. I think it's all technique, right? And so even though with the best technique, there are people who will respond different. I always tell them we're not twins, we're not identical. Even if your sibling came in and had the same product done, your skin may be in a different state than that their skin was in, right? And so it's all about individual process. And so even if you don't peel, though, you had the product applied and you get the benefit from the product. But some people will peel more, right? And it also depends, for me at least, on the way that the peel is applied. And that's why, since I have a smaller practice, I like to be present when the peel is being applied so that I know what's going on during that service.
Right. And that is an added benefit for sure. I'm going to tell you this other thing. It also has to do with what other products you're using and how often you're getting a chemical peel.
Yes.
If you're, using the strongest retinoid and a glycolic acid and doing your little micro, spears, and there ain't nothing to peel, I mean, it's the dead skin that's going to go. And if you're doing your peels every month, and constantly resetting that skin cell turnover, then congratulations to you. You don't have to peel to get the benefit. It's going to absorb into the skin. It's going to affect collagen production, and you're going to see results even if there's not. I'm in a constant state of exfoliation. It's rare for me to have this, crazy peel reaction unless I really take it up. And it's unusual for me to hear that people say the VI peel doesn't make them peel, because those are some of the strongest and most effective peels on the market since forever.
You hear that, Maria? Since forever. Just a quick shout out to my me ask this question. Why is VI peel body needed? Like, why do we really need this?
Well, for my patient population, I'm sure same with Corey, we have some other needs. You know, we think about what's on the face, we have the sun damage, we have the acne scarring for just maintenance, because if you can get your car's oil changed, you sure should be changing your own oil, right? Which includes all the spectrum that we're doing. So I think on the body, though, for me, I found that it is very effective on striae. Now, we're not talking about stretch marks that are just, I mean, you had the biggest baby in the world, or you had some massive weight loss. They may not be it may not be as effective on those. But I have found that in that, when we treat the body, the things that bother people and they come in for me to be treated are the striae that are on the skin, that post-inflammatory hyperpigmentation that you get around the joints. So those are areas that I'm able to treat where I would not have put the VIP for the face on those areas.
Correct. We need more product, and we need it to be tailored to the specialized skin in those areas. So patients come in, they have bacne, they have truncal acne, and we get that under control. Sometimes using the peel can help with that. But once the PIH sets in, nobody has time to be spot treating with the hydroquinone all over their back. And that's when the beauty of a product like the VI Peel Body comes into play, because it can get a lot done with little or minimal effort on the part of the patient. Of course, it still could take a series, but you're going to get there a lot faster. Folliculitis, it can help with that. You know, just all those, even all those rashes that we deal with as people of color that cause inflammation, that lead discoloration and scaliness behind. I love it for the hyperkeratosis on the knees and the elbows, like Keisha was talking about. But yeah, I mean, there's so many uses, even on like bug bites and discoloration on the legs, with large, widespread areas. I mean, that is an area, that is, I'm sorry, a condition, a problem that bothers people a lot and affects their self-esteem. And it can be not very cost effective to use topicals alone there, and other products that have been out before the VI Peel Body just have not been effective.
No.
Can you do it on the fanny? Because we're getting a lot of questions with that in the chat box.
Oh yeah, for sure.
Can you use
oh, absolutely. Yeah, when I'm talking about folliculitis, that's the area I'm really speaking of. The bottom, the groin, you know, larger areas like that, and just kind of evening all that skin tone out. You know, summer's coming, and people have their Instagram ready bikinis that they trying to get in. So
take that sarong off. Let us see it.
Yeah.
I
always say, when I go to the beach, you get what I pay for. So whether you like it or not, you are getting what I pay for.
I gotta add this in because I can tell by the way it's typed that someone really wants to know the answer to this.
Okay.
So if they are on any medications that you prescribe, or if they're on, say, Proactive, can they use the VI Peel Body? And where does that fall into their treatment protocol?
Yeah. So I like to ask patients who are on strong retinoids to maybe stop the strong retinoid 3 to 5 days, depending on the retinoid in the body area. And it's not that you will always have to do that, but the first few times you want to give the peel the benefit of the doubt, and you don't want to tempt the peel. And so we're not going to prep our skin any more than necessary. We're going to put it in a position to really be successful and win, and not give you any surprises. When you use hydroxy acids and retinoids, things that decrease the bonds between the cells and allow us to have more exfoliation, well, if the peel agent goes in there on that already prepped and primed skin, you may get more of a reaction than you're looking for.
Right. Gotcha. That makes perfect sense, because that often comes up in questions, and it in some ways leads to my next question. Why is the VI Peel Body, why is it so safe? Why is it one of the best? Because it's first of its kind, right? So why is it the safest and best way to treat, say, back acne, stretch marks, dark spots, you name it? Why is it so good for those things?
Well, I'll answer it on a high level. They did the work. Right? this is not a product that they came out with yesterday in the garage and then started telling people about it. They actually, and so for me, with this, Corey and I both have science backgrounds. I always follow the science, right? I don't want anecdotal anything because that can't be reproduced. And people are coming to me and paying cash, so they want reproducible results. So VIPO, they've done the work. They've tested it. They've seen what it works on. What's it effective on? You don't see them just saying it works on everything. They've highlighted and can show the areas that can be treated with this. And so they've done the work, and I believe, and I've seen it for myself. Now that's a high level answer. Corey is more, you know, he's on
the streets.
He's in the streets, so he knows.
Nobody believes that. But anyway, no, I mean, I think that is really it. You know, when you look at the products that have been on the market previously, they really never did the science and the nuance and the small little changes to take into account the fact that the skin on the body has fewer oil glands. The skin on the body could be thicker. So you're not going to have the same reaction as all the chemical peels that we have at our disposal when we use them on the face. The face skin can be, you know what I mean? So it's safer because it has been designed to really be used in those areas for maximum efficacy.
Okay, I'm going to go off script again and get this question in. Acanthos nigricans.
Yes.
Dr. Hartman, you please tell me if you would treat that skin condition of the neck.
Yeah.
What?
We use it all the time. We use chemical peels all the time. Right? It's a combination treatment. Yeah, so acanthosis nigricans is velvety dark plaques that you see in skin folds that have to do with insulin intolerance. So if you have that, that can be an indication that there are some medical things going on systemically that you should not be ignoring. So if you have a family history of obesity, hypertension, diabetes, all those things go into what we call syndrome X, and they can be linked to the development of acanthosis nigricans.
PCOS too.
Yes, and PCOS, correct. Now, you know, when you come to us and we tell you about the medical, we'll help you with the physical. You know, you got to listen to both. Because if you're not going to get the weight under control, you know. But yeah, after you have gotten those things under control, then we can start to work on the appearance of the skin. And that skin can be very thick and very dark, and chemical peels are a wonderful way of managing that.
And I just want to add just a quick disclaimer in for the folks that are listening in on our call tonight. VIPO face is good for that condition that's on the neck because body falls below the chest. So just want to make that clear. I don't want anyone tomorrow going, oh, acanthos nigricans, I can use the VI body peel. It penetrates too deeply for that area of the body. So I want to be really clear with that. But I wanted to be certain to answer that question in the chat box that you can use the VI peel face for the neck, not body.
Perfect.
Next question, and I think again this kind of leads into the emotional piece of how we're treating these sort of concerns with skin of color. How would you define the emotional component that comes with the issue of, say, stretch marks and dark spots?
For me, you know, I always say you have one chance to make your first impression, right? So when you meet a person, you immediately decide what you think about that person, right? And so when you have hyperpigmentation on your face, acne scarring, when you have any of these things that is not the true you, you don't present yourself in the best way. I don't care what people say, they don't. And so then what is perceived of you is not accurate, right? And I'm telling you, the majority of problems I think people have, like depression, anxiety, that kind of stuff, because you're not being your authentic self. And if you have these things that hold you back from being and living who you are, then it's an emotional toll on you because you're not being your authentic self. You're not. So outside of this whole anti-aging piece, the things that we're treating, this PIH, this acne scarring, this acanthosis, I mean, all these things keep us from shining. And with this skin of color, I mean, it is a beautiful skin. I mean, look at the hues that are on your screen. I haven't seen this much beauty. I mean, it's unbelievable actually sometimes. But I do believe when people have, you know, you say she's so angry or she's so whatever, or he's so this or he's that office, people can't be their full true self when they feel these kind of things and they don't give off that true personality. So you don't like them, or they don't show up good on their job, or they show up bad in relationships. I think it goes further than just being about skin.
100%. You know, in dermatology, we say that you have to wear the disease for the whole world to see. You can't hide it. Like, you can have kidney failure and nobody knows, or a heart problem. But when it's on your skin, it's just out there. And like Vakisha said, it affects every aspect of your life, whether you know it or not. It's going to impair your interpersonal relationships, your ability to go out, your self-esteem, to like get a job, your effectiveness on interviews for scholarships, like all of that has to do with it, because you can't help but to internalize those things. And like she said, you cannot really let yourself shine and be your true self because you're too caught up in trying to figure out how to hide it, and is anybody going to notice, and all those things. So I mean, yeah, that's something that we talk about all the time. There have been studies to support this as well. And you know, in our respective medical specialties, we understand that when other physicians may not get it, you know, because we deal with it every day.
So let's discuss the importance of suitable protocols when it comes to minimizing the risk of inflammation and post-inflammatory hyperpigmentation. We're talking about dark spots, folks.
Yeah, well, I touched on this earlier. You know, you want to make sure that you're going to people who know exactly what they're doing, because again, there's a fine line between doing it right and doing it wrong. So you want to make sure that the people are well versed in the product, have lots of experience, and really take the time to get to know you, your goals, your skin, your skin's history, you know, what you've been through, what medicines you're on, and really dig deep and get a sense of the ethnic background that makes up these beautiful brown hues. The world is a much more complicated place than it used to be. There's a lot of miscegenation, and it really does matter. I know some people can have walls up against that, or feel uncomfortable. I'm like, I don't understand why that's like an uncomfortable thing. What's your ethnic background? I mean, I love that question because it gets into so many other things, and it gives me the information that I need to not only prevent problems, but also just to get to know the person and to get a better sense of what it is that they're trying to achieve.
Right. I want to slide in real quick, and this is off script. Dr. Fripp, how would you use the VI Body Peel, being a prominent plastic surgeon? How would you enter your practice? I got to know that.
So, you know, as a surgeon, I have to say the best part of my day is when I hold a scalpel, right? So this is an accoutrement to my practice. So I don't want to give off as if this is what I do all day long, right? Corey is the best expert you can have because he knows skin. I know skin more technically from being a surgeon, how to make an incision heal without having hyperpigmentation, hypertrophy, that kind of thing. However, I do have about a 25% makeup of my practice that come in for skin issues. Now, things that get deep, if I get in the woods, rosacea, listen to me, you need to go see Corey, right? So we're not going to go too deep with this. But if you suffer from adult acne, I raise my hand. I understand what you're going through. So the first thing I always tell people, you have to stop the breakouts, right? So I have a product that we use in our office. But remember, I always tell people, go to the dermatologist first, right? So I mainly see people who have come to the other side of that issue, who have their adult acne is being treated in whichever way it's being treated, and they now have the acne scarring, they have the post-inflammatory hypertrophy, and people here, you wouldn't believe it, though this is DC, people are concerned about how their body looks. Like, we only get about 3 months to have our body out here, but in those 3 months, we might be naked.
It's all out.
We're all out. And it should not be all the time, but it is. And I applaud the girls for wearing it, baby. You got to give it to them. You got to give the people what they ask for. So they come to me for stretch marks. They come to me for those kind of things. And now they're coming more for those hyperpigmented elbows and knees because we want to be smooth.
Yes.
Okay, so you hit a great point, and you spoke about stretch marks, right? Because we know that VI Peel Body will address stretch marks.
Right.
It will address dark spots. If someone made a boo-boo, not you, you are cleaning up someone else's work, and there's light scarring that patient isn't comfortable with, would you use VI Peel Body for that to minimize the?
Absolutely. Again, right tool,
Ideal.
right
Right.
hands.
Right tool, right hands.
You know what I mean? Like, yeah, we do that all the time. I mean, one of the best ways to get over a chemical peel is to do a chemical peel.
That's right.
If your chemical peel wasn't done correctly and now you have an outcome that you didn't like. But again, we want to take into account what was used, what was the strength, how many passes, what was the application like. There's so many different things that go into it, which is why I really get nervous when people are ordering their stuff on Amazon. But that's another conversation.
Look, where's my pen? Okay.
We'll set that one up for later, Wendy. Yeah.
Things I hate. Check.
I'm going to take this moment just to make a quick announcement to our viewers. At the end of the session, so you've got to stay to the very end, we're going to be giving away some VI Derm Beauty skincare. Someone was saying, hey, do we have skincare? Do we have skincare at VI? Yes, we have skincare. Do I use it? Absolutely. So as we get back on topic with VI Peel Body, how would you rid someone of, say, dark follicles and to make them less prominent on the legs? Because that's a huge issue for women of color. You may have someone that says, that doesn't shave their legs, and you make, girl, why you not shaving your legs? And they go, because they look worse when I shave them. It just looks like I got spots everywhere.
Oh, wow.
Address that with VI Peel Body. If you're that person that, one, either you're not shaving because when you shave, you're going to have the pigmented dots from the hair follicle, or the person that still is brave enough to shave, how do you deal with these dark follicles?
Well, I don't know what Corey's going to say, but I would first say, what I would do is first, let's laser this hair off. Let's get this hair from growing, right? So, because I mean, we're trying to put Band-Aids on. I mean, we just put let's get the hair from growing first. Then you can treat the fact that the follicle is hyperpigmented or dark.
1,000% yes. I'm always about the lasering because that's 80% of the problem.
Yeah.
The other thing I'll say, I know we talked about this when we talked about strawberry legs a little while ago, so y'all go look that one up too, was that there are several diagnoses that can lead to that look. So you want to make sure that you're identifying the correct problem. But like Vakisha said, most of the time, just getting rid of that hair and that inflammation that can come as a result is going to knock out the majority of it. And then it's easy, smooth sailing. You can use VI Peel Body and a combination of other products to minimize the appearance of the dark spots. But once the hair is not there anymore, you're not going to have to deal with that part continuing to be worse.
So are you telling me we're going to have great legs in DC?
You have no reason not to have great legs. So remember, it's in the eye of the beholder. I always tell people, if you feel comfortable about it, or if something you just didn't know, it didn't bother you, you have to serve what you serve it, right? You are not for everybody. Somebody is always going to say something.
That's true.
If people aren't talking about you, you're not around enough people.
You're not around enough people.
That's it. That's it. It's a human nature. It's human nature to say something, right?
It's true.
Sure, it's human nature. So, but I do want you to serve it well, though. I want you to serve it in its best form. So go ahead and get that laser with that VIP, and then you can have your little short shorts on. And I'll be standing there applauding the whole time. I promise.
So to that point, what risk would you say you need to keep in mind with skin of color? And I'm going to add this little piece in.
Okay.
Because people can get very close to those areas that should not have any chemical peel near it because it's just not suitable. What are the risks? You're shaking your head, Dr. Hartman. What are the risks?
Yeah, well, there's peel protocol, right? So we talked about the role of the practitioner in right hands, right product, selection of patient, selection of indication that we're treating. But then we hand it over to you, and it's up to you to do the right things afterward, okay? Right. So when we tell you that we don't want you messing with it, we really mean it. When we tell you that we want you to trust the process and let the peel happen on its own with these instructions, we mean that. If you get, I'm tired of this stuff on my face, now I peel up. Okay, now you're messing up. You are interrupting the process, and you are potentially putting yourself at risk for infection, pain, bleeding,
Yep.
hyperpigmentation, more permanent scarring. So these are not light suggestions. You know, these are still medical treatments that are being delivered by a medical professional, and there's an aftermath and a protocol that we rely on you to continue to make sure that we're not having any issues. If it means staying out of the sun, if we tell you that, stay out of the sun.
Yeah.
If you have to use a different cleanser for a few days, then you need to take all that stuff into account, because you are our partner in helping to get your skin the way that you need it to be. It's not just one-sided. Just like you can't get it done all the time at home by yourself, we can't do just these treatments without your help.
Right.
Exactly. So as we wrap up on the topic of chemical exfoliants and their effectiveness, what would you recommend as post-treatment care for the VIPO body? What does that look like? What does that sound like? What should patients be asking?
Are we talking about after they follow the instructions and come with the feel?
Yes.
Yes.
Are you talking about after they've been compliant?
Correct.
Okay,
Yes.
well, go ahead, Corey. After they've been compliant.
So, you want to make sure that you have followed the instructions to a T, that you have not gotten into harsh That's not the time to be trying new things, right? So stay off of TikTok, stay off of Amazon, because you're going to be tempted to try all these things. Trust the process. Use gentle cleansers. Use bland moisturizers and emollients. Give your skin the time to go through the process. Encourage that exfoliation in a controlled manner, and give it time to heal. Because when we induce these injuries, we know that we're putting the skin in a vulnerable state. And we do that because we know that if everything goes the way that we plan, the outcome is going to be fabulous. But if anything goes awry when that skin is vulnerable, we can take steps backward. So that's the time to do less, not more. That is the time to follow the instructions. That is the time to stay out of the sun, not experiment with other harsh ingredients. Keep it really simple, especially if you have skin of color. Because our skin carries a more inherent risk of hyperpigmentation and deleterious effects from overinflammation. That's not to say that you can't do certain things, but you really want to pay attention if you have brown skin, because the more melanin that you have, once those skin cells are disrupted, the melanin has to go somewhere. And when it settles into the skin, that's when you get the dark spots that you're trying to avoid and prevent and treat.
Absolutely. So would you say that VIPO body and VIPO face, for that matter, is it for all skin types?
For 1,000% yes. Don't let anybody tell you no. Yeah, 1,000% yes. Remember, right product, right hands. In the right hands is fabulous. It has been my go-to when I'm really trying to get, and this is before Precision Plus and all that. I'm talking like I'm an OG in this thing. We've been with the VIPO. I've been impressed from the beginning. Just that little touch of TCA. People will tell you TCA isn't for Black people. That's not true.
That's not true.
Right product, right hands.
All right, this is going so well, and people are popping in with so many great questions, and they're staying with us. Someone asked here, and this is a little bit off topic, is microneedling for dark skin tones? Can we microneedle?
1,000% yes.
Okay.
We've seen people, I don't do microneedling in my office, but I've never seen a product, it done, if it's done by the right person.
Absolutely.
So you hear about things that go bad because the person doing it is not the person that should be doing it.
Exactly.
Then it gives the whole process a bad name.
Absolutely. And I want to just thank you too. You mean so much to me. You mean so much to the Black community. You mean so much to Vitality Institute, maker of VIPO and VIPO Body and VIPO Derm Beauty. We just thank you so very much for giving us your time. This has been so much great fun. So many people that came in and had their questions, and hopefully we answered a lot of those questions. But I'm going to ask this question really quickly before I let the doctors go. The first person that enters into the chat box, it can be yes or no, only yes or no, is the VIPO body for skin of color. Let's see.
Is this for the prize?
Yes, this
is
for the prize.
Yes.
Come on. Who's gonna win? Let's see. Who's gonna win?
I want the prize.
We appreciate that, but we want to know who's gonna win.
Right.
Oh,
Y'all so nice.
TL
Steeler
Davis,
shit. I think she won.
send us a DM, okay?
Oh,
Send
my
us a DM.
goodness. Oh, I see all the yeses now.
Now they're coming in. Yeah, we're a little delayed.
I see it. I see
Wendy, thank you so much for having us. Listen,
Yep.
whenever Vakisha and I get together, it's always a fun time. We had to kind of keep it, a little G-rated tonight, but
Right.
we usually throw all the way down. So it's so good to
Corey
see
and
you.
I are Meharry Medical College finest.
Yes, we
we're
are.
also a part of the first of finest. When you start at the top, you never look behind.
You never look down.
Never look down. But we feel the same way about our patients, though. So we want you all to think we feel like we're a part of the same group. We want you all to be at the top too, right? Yep. So that's why it's always important to go to the best.
There you go. I love it.
Absolutely. Again, I can't thank you enough. What you do means so much to the Black community, and what you do means so much to your colleagues that have questions and would like to make certain that their protocols and their post-treatments are aligned to what the experts are doing in skin of color. And I can't thank you enough. Looking forward to doing this again.
Sounds great. Thanks, y'all. Have a good night.
Thank you so much. Good night. All right. Good night. Bye.
Bye.